Welcome to the School-Based Healthcare Services 101 training. This training provides an in-depth look at the School-Based Healthcare Services, or SBHS, Medicaid Reimbursement Program. The SBHS 101 training is intended for school districts who are interested in learning more about the SBHS program, new SBHS coordinators or newly contracted school districts, school providers who participate in the program, as well as any other interested school staff or stakeholders. More information about the SBHS program can be found on the SBHS webpage. We will be going over a lot of information on today's training. Please note that a PDF of this training is available on the SBHS webpage. The PDF version has active hyperlinks to SBHS resources, trainings, and websites. In addition, all of the information presented in today's training can be found in the SBHS billing guide, also available on the SBHS webpage at hca.wa.gov/SBHS. SBHS Overview. The School-Based Healthcare Services, or SBHS program, is an optional Medicaid program which provides reimbursement to contracted school districts, ESDs, charter, and tribal schools for providing medically necessary healthcare-related services to Medicaid-eligible children who receive special education health-related services per an IEP or early intervention health-related services per an IFSP. In order to be reimbursable, services must be a Medicaid-covered service, must be included in a student's IEP or IFSP, must be prescribed or recommended by a Department of Health licensed provider, and must be provided by or under the direction of licensed healthcare providers. This program allows school districts to receive reimbursement for services that they are already required to provide per the Individuals with Disabilities Education Act. The SBHS program will not cover all of a school district's costs for providing special education and related services, but it can definitely help supplement the district's special education budget. The SBHS program is administered by the Healthcare Authority, or HCA. HCA is the state Medicaid agency in Washington, and it is also the agency that manages the health benefits for state and school employees. The main contact for the SBHS program is HCA's SBHS Program Manager, also known as the SBHS Program Specialist. Any questions about the SBHS program should be directed to the SBHS Program Manager. Many parents and/or schools worry that if their school district participates in the SBHS program, this will somehow affect services that students may receive outside of the school setting. Please note that receiving services through the SBHS program will not affect service delivery that students receive outside of school. In fact, most children who receive school-based services also receive services from an outside therapy provider. It is recommended that school providers and community providers coordinate care in order to ensure students are receiving the best possible care. Before we can fully understand the SBHS program, it is important to understand the Medicaid program and how Medicaid and the Individuals with Disabilities Education Act intersect. Medicaid is a health insurance program set up by the federal government and administered differently in each state. The Centers for Medicare and Medicaid Services, or CMS, manages Medicaid nationally. In the simplest terms, Medicaid is a combination of federal and state dollars that pay for CMS-approved services that meet the CMS definition of medically necessary. Services must be delivered by or under the direction of providers who meet specific licensing or credentialing criteria in order to qualify for Medicaid reimbursement. Each state has flexibility in how they administer their Medicaid program, but all states must follow CMS guidelines and regulations. In Washington State, the Medicaid program is also known as Apple Health. On this slide, we can see how Medicaid and the Individuals with Disabilities Education Act intersect. Prior to the 1988 Medicare Catastrophic Coverage Act, Medicaid did not pay for any services listed on a child's IEP or IFSP since they fell under educational services, and Medicaid at that time stipulated that Medicaid would be the payer of last resort. As we can see on this slide, in 1988, approximately 20 years after the passage of Medicaid, the Medicare Catastrophic Coverage Act of 1988 was amended, which would permit Medicaid payment for medical services provided to children under IDEA through a child's IEP or IFSP. This amendment was enacted to ensure that Medicaid would cover the health-related services under IDEA. This was a huge win for schools as they could now start receiving extra dollars for those services that they are federally required to provide per IDEA. The following entities are allowed to participate in the SBHS program: public school districts, educational service districts, charter schools, and tribal schools. Currently, the SBHS program contracts with approximately 180 school districts and 4 ESDs. It is more common for school districts to hold the SBHS contract with Healthcare Authority and bill for services. However, it is becoming more common for ESDs to hold a contract with the program in order to bill for services for multiple districts. In order to get an idea of which districts within your area are participating, a list of all currently contracted school districts is available on the SBHS webpage and is also hyperlinked on this slide. On this slide, we will take a look at some benefits of participating in the SBHS program. As we all know, school staff are busy enough. Why would a district choose to participate in an optional program which will just add to an already full plate? As mentioned on a previous slide, the SBHS program allows schools to receive Medicaid reimbursement for services that the district is already federally required to provide per IDEA. School staff are already providing these services, so why not participate in the SBHS program in order to receive additional reimbursement? In addition, even though this program is optional, meaning that districts do not have to participate, OSPI does require school districts to bill Medicaid in order to receive certain safety net apportionments. Participation in the SBHS program does satisfy OSPI's Medicaid billing requirement. With that being said, most districts in Washington do participate in the SBHS program. As you can see on this slide, the typical annual reimbursement for districts may vary based on the number of eligible students, the number of eligible providers within your district, and the amount and duration of services a child receives per their IEP or IFSP. Smaller school districts with fewer students and fewer providers can expect to make approximately $3,000 annually. Larger districts can expect to earn anywhere from $150,000 up to approximately $500,000. The Healthcare Authority doesn't regulate how Medicaid funds are spent. Reimbursements earned through this program can be used in a variety of ways. Districts can use funds to hire additional school staff, purchase assistive technology devices, provide professional development for school staff, etc. Most districts may choose to put the money back into their special education budget, but it really is up to each district how they choose to spend their money. On these next few slides, we will take a look at the resources available to districts who choose to participate in the SBHS program. All SBHS program materials and resources can be found on the Healthcare Authority's SBHS webpage at www.hca.wa.gov/SBHS. I recommend all participating school districts bookmark or save this webpage as a favorite. Some of the resources that are available on the SBHS webpage are the SBHS Billing Guide, resources and trainings for both SBHS coordinators as well as for servicing providers, a list of contracted school districts so you can see which of your neighboring districts are participating, as well as past program notifications and newsletters. Also available on the SBHS webpage is a sample SBHS contract. Districts who are thinking about participating in the program may view the sample contract before making a decision about whether they want to participate or not. Non-participating districts who have decided they want to participate in the program may download the checklist for new school districts to assist them with getting started with the program. If your school district is currently not participating in the SBHS program but would like to participate, this slide provides information on next steps. Step 1, continue to watch this training. Step 2. Non-participating school districts may download the SBHS checklist for new school districts, which is available on the SBHS webpage. Of course, interested districts may also reach out to the SBHS program manager with any questions. One of the resources available on the SBHS webpage is the SBHS Billing Guide. The SBHS Billing Guide is essentially the program manual for the SBHS program. The billing guide is intended to be used by school district administrators, SBHS coordinators, as well as providers who participate in the program. The billing guide details how to bill correctly for SBHS services, including current billable codes, documentation requirements, how to bill for telemedicine, etc. The guide also lists SBHS covered services, non-covered services, information on program monitoring, eligible provider types, eligible students, etc. In most cases, answers to frequently asked questions can be found in the SBHS Billing Guide. A link to the current and past versions of the guide is available on the SBHS webpage. SBHS coordinators and providers may print out a copy of the guide, but it is recommended that the guide be accessed and viewed electronically. This ensures the district is viewing the most recent version. In addition, there are active hyperlinks throughout the guide which can only be accessed if viewing electronically. In each version of the SBHS Billing Guide, readers will find a comprehensive table of contents at the beginning. The billing guide is broken into the following sections: resources available, definitions, program overview, student eligibility, provider qualifications, covered services, coverage tables, documentation, billing and payment, and program integrity. When accessing the guide online, districts can use the Control-F search function in order to quickly and easily find the topic in question. As mentioned on the previous slide, it is best practice to access the guide online rather than printing so that you can easily search for topics and you can access any active hyperlinks. As mentioned previously, it's very important that SBHS coordinators and servicing providers who participate in the SBHS program have access to the SBHS Billing Guide. The guide is typically updated annually, but may be updated quarterly as program changes or updates occur. The current version, as well as past versions of the SBHS Billing Guide, can be found on the SBHS webpage. When you click on the link for the billing guide, you will be redirected to another HCA page, which contains billing guides for all Medicaid programs. The SBHS Billing Guide can be found under the letter S, and the most current version will be on the top of the list, as can be seen on this slide. When participating in the SBHS program, it is very important to assign at least one person who will be known as the SBHS coordinator. This person will be the main contact for the program and will work closely with HCA's SBHS program manager. On these next few slides, we will take a look at the role of the SBHS coordinator. The role of the SBHS coordinator may vary by school district, but typical tasks and activities include enrolling providers into the Provider One system, which we will go over a little bit later on in this training, maintaining the provider and contact update form, receiving SBHS GovDelivery email notifications, sharing trainings and messages with providers, and submitting claims into Provider One if you are a self-billing school district. If you are new to your role as the SBHS coordinator for your school district, you will find a checklist for new SBHS coordinators available on the SBHS webpage under Resources, and then under the SBHS Coordinators accordion. New coordinators should download the SBHS checklist and complete any action items. New coordinators may also contact the SBHS program manager with any questions about next steps. In addition to the new coordinator checklist, SBHS coordinators will find additional resources on the SBHS webpage under the SBHS Coordinators tab. Resources include a link to the SBHS Billing Guide, trainings and webinars, FAQs, quarterly newsletters, and program contact information. On these next few slides, we will take a look at the Medicaid billing system utilized here in Washington State, which is called Provider One. One of the first things districts will do after signing a contract with the SBHS program is to set up their Provider One account. Provider One is Washington State's free, secure billing system for fee-for-service Medicaid claims. SBHS contracted school districts must have their own Provider One or P1 account. School districts and contracted providers are enrolled under the school district's Provider One account. Services rendered by providers are entered into Provider One as claims. Whether you self-bill or work with a billing agent, all claims are entered into the Provider One system, and this is how your district is paid for the services provided. If your district self-bills, the SBHS coordinator will submit claims into Provider One. If your district contracts with an outside billing agent, the billing agent pulls the data your providers enter into their service log software and uploads that information into Provider One. Later on in this training, we will go over in more detail how districts are reimbursed, the life cycle of a claim, and what it means to self-bill or work with a billing agent. Before setting up a Provider One account, the school district must first enter into a contract with the SBHS program. The school district must then apply for a National Provider Identifier, or NPI, and must complete an online Provider One application to enroll as a billing provider. Once the district's Provider One account is approved, the SBHS coordinator will then enroll all servicing providers such as the school's nurses, occupational therapists, physical therapists, speech therapists, etc., under the district's Provider One account. In order to enroll providers, each provider will also need to obtain a National Provider Identifier. Setting up the school district's Provider One account may take anywhere from 3 to 6 months. In addition, enrollment of individual providers may also take 3 to 6 months. It is very important for school districts to get their Provider One account set up and ensure individual providers are enrolled soon after signing the SBHS contract. This will ensure that districts can begin Medicaid billing as soon as possible. Located on the SBHS webpage and hyperlinked on this slide are multiple trainings which will assist new districts and new coordinators with getting the Provider One account set up and accessing Provider One and enrolling providers. In addition to online trainings and resources, HCA does provide Provider One training to SBHS coordinators. Provider One trainings consist of assistance with enrolling providers, how to check Medicaid eligibility, how to review paid and denied claims, and how to enter claims if your district is a self-billing district. School districts and SBHS coordinators interested in receiving one-on-one provider training may contact the SBHS program manager or the provider relations team for more information. On these next few slides, we will take a look at how to check Medicaid eligibility and other criteria to determine which students your district is able to seek Medicaid reimbursement for. The SBHS program allows school districts to receive Medicaid reimbursement for special education health-related services provided to students ages birth through 20 who have active Medicaid coverage and who have either an IFSP or an IEP. Eligible services must be included in the IEP or IFSP in order for the district to receive reimbursement. In addition, the district must obtain a one-time parental consent and must also provide an annual notification per the Individuals with Disabilities Education Act regulations. Because parental consent is an IDEA requirement and is not a Medicaid requirement, I will briefly provide an overview of the consent requirements. However, any questions related to consent should be directed to OSPI for Part B services and to DCYF for Part C services. IDEA requires a one-time written consent per school district to verify Medicaid eligibility for school-based Medicaid reimbursement. In addition to a one-time consent, an annual notification for the disclosure of student information must be provided to parents or guardians. Parents may revoke consent at any time. School districts may not seek reimbursement for any services provided before consent is obtained and may not seek reimbursement for services after consent is revoked. Again, because consent is not a Medicaid requirement, consent forms do not need to be submitted to the Medicaid agency, but should be kept on file at the district. Any questions related to consent should be directed to the appropriate state agency, as can be seen on this slide. There is additional information in the SBHS billing guide regarding student Medicaid eligibility and how to check eligibility in the Provider One system. If your district contracts with an outside billing agent, they will provide you with a monthly eligibility report. However, it is still helpful for a district to know how to check eligibility on their own in case they need to confirm Medicaid eligibility status in between the monthly reports. Because Medicaid eligibility can change month to month, it is recommended that school districts perform monthly eligibility checks to ensure students have coverage before submitting claims. HCA's Checking Medicaid Eligibility training, available on the SBHS webpage, provides step-by-step directions on how to check Medicaid eligibility in Provider One. Again, if the district contracts with a billing agent, the district may not need to perform their own eligibility checks, but this is good information for districts to have in case they need or want to double-check Medicaid eligibility at any given time. On these next few slides, we will take a look at which of your school staff or contracted providers can participate in the SBHS program, and we will also take a look at how to enroll these providers in the Provider One system. In order to receive Medicaid reimbursement through the SBHS program for IEP or IFSP health-related services, the services must be provided by or under the direction of a Department of Health licensed provider. Providers may be school staff or contracted providers. Providers working for or contracted with multiple school districts must be enrolled as a servicing provider under each district's Provider One account. Please note that ESA certification is not required in order to bill Medicaid. Non-licensed school staff who are practicing under the direction of a licensed provider may also participate in the SBHS program. On the next few slides, we will take a more in-depth look at requirements for licensed providers and non-licensed school staff. Listed on this slide are eligible provider types who may participate in the SBHS program. There are 14 licensed and certified provider types who may participate in the program. In addition, non-licensed school staff who are providing services under the direction of a licensed provider are also eligible to participate. This list of SBHS eligible providers can also be found in the SBHS billing guide, hyperlinked here. Licensed providers participating in the SBHS program must hold active and unrestricted licensure with the Washington State Department of Health, must have a national provider identifier, and must be enrolled as a servicing or rendering provider under the school district's Provider One account. If the provider works at multiple districts, the provider must be enrolled as a provider under each district's Provider One account. In contrast to licensed providers, non-licensed school staff who are providing services under the direction of a licensed provider do not need to be enrolled in Provider One, they do not need an NPI, and they do not need to be listed on the Provider and Contact Update form or the signature log. All services provided by non-licensed school staff must be provided under the direction of a licensed provider per their scope of practice and must be submitted as a claim under the supervising provider's NPI in Provider One. As mentioned previously, all licensed providers who will be participating in the SBHS program must be enrolled by the district's SBHS coordinator as a servicing provider under the school district's Provider One account. Step-by-step directions on how to enroll servicing providers can be found on the SBHS webpage. If SBHS coordinators have questions or need assistance with enrolling providers in Provider One, they may contact HCA's Provider Enrollment Office or the Office of Provider Relations. Contact information is available on this slide for both offices. Once the district has enrolled all licensed servicing providers in Provider 1, the district is now able to submit claims for services provided by these school-based or contracted providers. In order to ensure providers understand SBHS program and Medicaid documentation requirements, providers should view the provider-specific training available on the SBHS webpage. Providers should also have access to the current SBHS billing guide. The SBHS billing guide lists all billable codes for the SBHS program. It provides explanations on how to bill for certain codes, and the guide also describes documentation requirements. These are all elements providers will need to be aware of when billing Medicaid. A little bit later on in this training, we will take a closer look at documentation requirements and provider treatment notes. In addition to enrolling providers in Provider 1, districts participating in the SBHS program are also required to complete and submit to HCA's SBHS Program Manager the Provider and Contact Update form. This form is typically completed by the SBHS coordinator and is due to the HCA SBHS Program Manager annually at the start of the school year, as well as throughout the school year as provider and school district contact information changes. This form is also a handy way for districts to keep track of all licensed providers who participate in the SBHS program. In addition to the name of each provider, the district will also enter the provider's license number, NPI, license expiration date, start date with the school district, etc. The district must list all providers who will be participating in the SBHS program, as well as current school district contact information, such as the name and contact information for the SBHS coordinator, accounts payable contact, special education director, business manager, and superintendent. This form is intended to be a working document and should be kept in its original Excel format so that the district can easily add and remove new providers and contact information as this information changes. SBHS coordinators should be working off of the same form year to year. However, a blank form is available on the SBHS webpage under Resources and the SBHS Coordinator accordion. All licensed providers who will be participating in the SBHS program for the current school year must be listed on this form. Please note that non-licensed individuals do not need to be listed on the form. SBHS coordinators should add a resignation date for any providers who have left the district over the summer. SBHS coordinators must also ensure that the contact information listed on the Contact Information tab is up to date before sending the form to HCA's SBHS Program Manager. There are instructions at the bottom of the form to assist districts with completing, and additional information about how to complete the form can also be found in the SBHS Billing Guide. Any questions about this form should be directed to HCA's SBHS Program Manager. In addition to the provider and contact update form, school districts who participate in the SBHS program must also maintain a signature log with the printed name and signature of all licensed providers who participate in the program. The signature log must contain the elements listed on this slide. A sample log is available on the SBHS webpage for districts to download and use. Please note that this form does not need to be submitted to the HCA, but must be kept on file and made available during any program monitoring activities. A list of all SBHS covered and non-covered services can be found in the SBHS Billing Guide, as well as in WAC 182-537-0400. School providers perform a variety of activities and services on a daily basis. However, there are specific services that Medicaid will pay for through the SBHS program. The SBHS program provides reimbursement for the following healthcare-related services as long as they are included in a Medicaid-eligible student's IEP or IFSP. Audiology services, mental health services such as individual and group counseling, nursing services such as medication administration, diabetes care, seizure care, etc., occupational, physical, and speech-language therapy services. In addition to direct services, the SBHS program also provides reimbursement for evaluations and re-evaluations when provided by Department of Health licensed providers. Evaluations and re-evaluations are reimbursable only when they result in an IEP or IFSP in the specific service being evaluated. In order to be reimbursable through the SBHS program, services must be included in the IEP or IFSP Summary of Service Matrix with the service clearly listed, the frequency of services, and the staff responsible for delivering the services. Makeup sessions may be reimbursable when the provider clearly documents in the treatment notes that the session is a makeup session. In order for Medicaid to pay for services through the SBHS program, services must be prescribed or recommended by a licensed provider. For the SBHS program, the providers listed on this slide may recommend or prescribe services per their scope of practice. If the school does not have a licensed provider on staff who can recommend or prescribe services, the school district must obtain a referral or prescription from an outside physician, such as the student's primary care provider. A list of covered services and a list of all billable codes are available in the SBHS billing guide. Providers participating in the SBHS program must ensure they have access to the most current SBHS billing guide in order to ensure they are billing appropriately. The CPT and HCPC codes found in the billing guide are developed and owned by the American Medical Association. Providers must use their professional judgment to determine the most appropriate code to use based on the services provided. The SBHS program manager can provide guidance on SBHS policies and procedures, but cannot tell providers which codes to use. When accessing the billing guide, providers should find the coverage table relevant to their provider type. For example, speech-language pathologists will use the codes listed in the Speech-Language Pathology Services coverage table. As mentioned on the previous slide, providers must use their professional judgment to determine the best code to use based on the short description found in the guide. If time is indicated in the comments column, this means the code is timed and can be billed multiple times per day. If left blank, this means the code is untimed and more than likely can only be billed once per day. Telemedicine. Services provided via HIPAA-compliant audio and visual telemedicine platforms, as well as through audio-only telephone calls, may be reimbursable through the SBHS program. Providers are encouraged to review their scope of practice with the Department of Health to review whether specific services they are providing are allowed to be rendered via telemedicine. More information and detailed instructions on how to bill for telemedicine can be found in the SBHS billing guide. The SBHS fee schedule provides a list of all billable SBHS codes and their maximum allowable rate. If your school district decides to self-bill, the fee schedule will be important as districts are required to enter the rate for each code when submitting claims in Provider 1. HCA updates the fee schedule annually in July as the national codes and rates are updated by the Federal Centers for Medicare and Medicaid Services. A copy of the SBHS fee schedule can be found on the SBHS webpage, and additional information about the SBHS fee schedule and rates can be found in the SBHS billing guide. As mentioned previously, there are some activities and services provided by school staff that may not be reimbursable through the SBHS program. Services or activities may not be reimbursable because they are not a Medicaid-covered service, they are already reimbursed through another Medicaid program, or reimbursement for the activity may already be included in the rate for the covered CPT or HCPC code. The list of non-covered services found on this slide can also be found in the SBHS billing guide. When participating in the SBHS program, districts and providers must adhere to Medicaid documentation requirements. The documentation requirements for the SBHS program can be found in the SBHS billing guide, as well as in SBHS WAC 182-537-0700. Documentation must verify the level, type, and extent of services provided to each student to fully justify what is submitted for reimbursement. Chart notes must be authenticated by the performing provider and supervisor as necessary. and must be legible, accurate, and complete. Medicaid requires treatment notes, evaluation assessment reports, and other documents that verify billing be maintained for 6 years. Documentation may be stored electronically as long as records are made available to the SBHS program manager during monitoring activities. Your district and/or OSPI may have stricter documentation retention schedules, but for Medicaid purposes, documents only need to be maintained for 6 years from the date of service. If your school district contracts with an outside billing agency, providers will keep treatment notes in a service log template provided by the billing agent. If you are a self-billing school district, you will need to create a treatment note template that entails all of the documentation requirements as outlined in the SBHS billing guide. Whether your district contracts with a billing agent or self-bills, treatment notes must contain the following items: the student's name, date of birth, and provider 1 client ID, the date of service, and for each date of service, the time in and time out, a procedure code, a description of each service provided, the child's progress related to each service, whether the treatment described in the note was individual or group therapy. There may be additional requirements for documenting when services were provided through telemedicine. Information on how to document telemedicine services can be found in the SBHS billing guide. Federal and state regulations state that health records, such as patient charts and treatment notes, be authenticated by the provider who gave the order, provided the care, or performed the examination, assessment, or treatment. The provider's signature on all records and treatment notes verifies the services have been accurately and fully documented, reviewed, and authenticated. It confirms the provider has certified the medical necessity and reasonableness for the service provided. Treatment note should contain a signature of the provider who performed the service and the signature of the supervising provider, if applicable. The SBHS program does allow electronic signatures. Whether your district utilizes electronic signatures or handwritten signatures, a signature log must be maintained by each district. A sample signature log is available on the SBHS webpage under Resources. On these next few slides, we will take a look at additional billing requirements and the claims payment process. Additional information about these billing processes can be found in the SBHS billing guide and in WAC 182-537-0600. As mentioned previously, when participating in the SBHS program, school districts have the option to contract with an outside billing agency who will assist the district with claims submission. Districts may also choose to be a self-billing school district, which means that the district will submit all claims directly into the Provider One billing system and will not work with an outside billing agency. Both options have pros and cons, which we will take a look at on this slide. Participation in the SBHS program is free. However, if your district contracts with an outside billing agent, your district will be responsible for paying the billing agent or third-party vendor for its services. Most billing agents charge a percentage of claims billed. However, if your district decides to contract with a billing agent, that is something you will need to work out with the billing agent. One nice thing about working with a billing agent is that they provide online documentation software, which allows providers to electronically document the IEP or IFSP services provided. The documentation software is usually tied in or connected to the IEP software that the district uses, so it makes for a seamless process. After providers electronically document their services in the documentation software, the billing agent uploads that information into Provider One, which then generates a batch of claims. Billing agents also assist districts with obtaining parental consent and confirming Medicaid eligibility so that they know which students they can bill for. Now let's take a look at self-billing. The most obvious benefit to self-billing is that your district is not paying a third-party vendor to process claims, which allows the district to maintain all of their Medicaid reimbursements. When self-billing, the district will need to ensure that they have 1 or 2 SBHS coordinators who will be in charge of entering all the claims into Provider One. Claims can be entered daily, weekly, or monthly. It's really up to the district how often they would like to submit claims. When self-billing, the district would also need to ensure that they have a treatment note template for providers to document all services provided, and providers would need to be sure to provide their treatment notes on a consistent basis to the SBHS coordinator so that the information from the notes can be entered as claims into Provider 1. When self-billing, the district will also need to ensure they obtain consent prior to billing, and they should also do monthly or quarterly Medicaid eligibility checks to ensure that they are only billing for students who have active Medicaid coverage. As mentioned previously, there are pros and cons to both options, and it really is up to each district what they would like to do. Districts can always reach out to HCA's SBHS program manager for more information about which option might work best for their district. School districts who have decided to self-bill may access the How to Submit SBHS Claims training available on the SBHS webpage. HCA also offers free Provider One training to interested school districts. Districts interested in receiving Provider One training may contact HCA's SBHS program manager. Districts who contract with an outside billing agency should contact their billing agent on the claim submission process, as it will be a little bit different. Whether you are a self-billing school district or if your district contracts with a billing agent, your district and your providers are required to bill according to the SBHS Billing Guide, SBHS WAC, and the SBHS contract. This means ensuring claims are submitted in a timely fashion, keeping proper documentation, participating in all program monitoring activities, etc. Districts and providers are responsible for the accuracy of all claims submitted to the Medicaid agency. Whether your school district self-bills or if your district contracts with a billing agent, the claim submission process looks pretty much the same. As we can see at the top of the life cycle of the claim, we have the provider providing a service to the student. The provider documents the service per the documentation requirements in their treatment notes or service logs. The provider submits the treatment notes to either the SBHS coordinator for self-billing districts or to the billing agent for districts who contract with a billing agency. The SBHS coordinator or billing agent then enters the information from the treatment notes into Provider One as claims. Claims that were entered incorrectly will automatically deny. Claims that will deny include services provided to a student who is not covered by Medicaid, inputting the incorrect gender or date of birth, forgetting to include the servicing provider taxonomy on the claim, etc. School districts will have 24 months to correct and resubmit any denied claims. Claims that were entered correctly, also known as clean claims, will process, and school districts should receive payment via electronic funds transfer or via check within a week to 2 weeks. The remittance advice, or RA, is a document that is loaded into Provider One on a weekly basis. The remittance advice shows all paid, denied, and adjusted claims. SBHS coordinators and other district staff can use the RAs to help track which claims have been submitted and whether the claims have denied or paid. If a claim has denied, a description of the denial will also be available on the RA. When participating in the SBHS program, your school district and your providers are considered Medicaid providers. This means that your district and providers must adhere to federal and state Medicaid requirements, one of which includes the provider revalidation process. Per the Affordable Care Act, HCA is required to validate Medicaid provider information every 5 years. HCA has been conducting provider revalidation activities since 2013. If your district is selected for revalidation, you will be contacted via letter from our Provider Enrollment Office. The revalidation notice is sent to the contact and mailing address listed in Provider One. Districts should contact the Provider Enrollment Office with any questions regarding the provider revalidation process. HCA conducts program monitoring activities to ensure school districts are adhering to SBHS program requirements as well as state and federal Medicaid rules. School districts who participate in the SBHS program must participate in all program monitoring activities. Program monitoring may be in the form of a site visit or a desk review. Districts chosen for monitoring will be notified by HCA's SBHS Program Manager via email. In order to review student records, districts will be asked to upload student records to the SBHS Secure File Transfer site. If your district is chosen to participate in a review, the SBHS coordinator will receive a unique user ID and password, which will enable the district to upload files securely. Typically, a monitoring will consist of a review of records for a specific list of students within a specific time frame. Students and records may be chosen at random, or students and a time frame may be chosen due to unusual billing practices. HCA recovers overpayment if a school district is found out of compliance with the Medicaid and program requirements. If needed, a school district may be placed on a corrective action plan. That concludes the SBHS 101 training. On this slide, you will find important HCA contact information. The main contact for the SBHS program is the SBHS Program Manager. School district staff, SBHS coordinators, and providers may reach out to the SBHS Program Manager at any time with questions or concerns. Thank you for viewing the SBHS 101 training and have a great day.